Hi, my name is Jill Harris, and I'm co-principal investigator for the development and implementation of healthcare transition resources for youth with autism spectrum disorders within a primary care medical home quality improvement project. Transition from pediatric to adult healthcare presents unique challenges for teens with autism who often have complex medical and mental health needs. Our special needs primary care team at Children's Specialized Hospital, which is based in New Jersey, recognized the need for improved healthcare transition for adolescents with autism as they head towards adulthood. With support from the New Jersey Governor's Council for Medical Research and Treatment of Autism, we developed a transition care tool to address gaps in current transition practices. Our team will tell you more about the issues, what we did, and what we found.
I'm Shannon Swope, social worker for the project. A review of the literature and surveying families in our own practice found that smooth healthcare transition is a largely unmet need for adolescents and young adults with autism. Parents and adolescents felt comfortable with their pediatric provider after years of building that relationship, and pediatric providers had difficulty letting go of their patients. There were concerns that adult medical providers have limited experience working with adults with autism and that communication between the pediatric and adult providers during transition is lacking. When they did occur, transition conversations by pediatric providers typically were delayed until the patient was nearing 18 or even later. This left little time for planning and coordinating a complex process that is further complicated by the variety of co-occurring conditions, symptoms, and support needs that patients may experience. Finally, there were a limited number of age and language appropriate resources to guide families through complicated processes like insurance coverage and guardianship, and few resources encouraged autonomy among adolescents to take increasing responsibility over their own care.
I'm Aditi Doshi, project manager. In planning our quality improvement project, we reviewed existing resources from GOT Transition, a national resource center with the aim to improve healthcare transition. We surveyed practice staff to identify how transition was being addressed with patients and what they found challenging within our practice environment. We evaluated current processes to determine what needed improvement and conducted a system assessment to determine how enhanced integration with electronic health record technology could support healthcare transition for our patients. The team developed resources for families to guide the process and ensure standardized information was presented.
I'm Shaylee Dixon-Page, nurse practitioner for the project. The transition resource guides were a printed or electronic collection of transition-related resources specific to 3 age groups, starting at age 12 and going to age 21. The topics included safety, sexuality, education beyond high school, guardianship and supported decision-making, housing, supplemental security income, Medicaid, and other insurances. A list of adult providers in the local area was created to help parents identify a new provider. Resources were designed for both youth and caregivers. Spanish resources were distributed when available. For the primary care practice, a transition template was installed within the electronic health records adolescent well visit. This was done to prompt discussions about transition, guide providers through the important topics, and track essential transition-related information for each patient. The HEADS assessment, a common tool that providers use when assessing adolescents, was adapted to address the unique needs of individuals with ASD, including autism-specific safety concerns, social skills, and daily living skills. Finally, a transition visit was created within the practice to encourage patients and providers to have visits specifically devoted to transition planning and related updates.
I'm Lee Gorman, social worker for the project. Our team then conducted trainings for families and pediatric medical providers to introduce the newly developed transition tool and resources. Results show that, while the supports did help increase the amount and quality of help patients and families received, pediatric medical providers skipped or put off transition discussions in approximately half of well visits for targeted patients. Challenges in implementing the transition process included finding time to discuss transition-related issues with patients and families, preference of pediatric medical providers to have social workers discuss transition, and difficulty identifying adult healthcare providers who are willing to see patients with autism. We hope that sharing these findings, as well as the tool and resources that we developed, will help other practices, patients, and their families struggling to achieve better transition outcomes.